There is something about autism that very few people are willing to say publicly. And I'm not saying this to criticize anyone. I'm not saying this to attack treatments. I'm not saying this to attack professionals. I'm saying it because I have spent decades working directly with neurodivergent children and their families. And there is a human reality that often never appears in textbooks, clinical graphs, or treatment reports. The truth is that many children improve behaviorally, but emotionally they continue to suffer. And that difference changes everything. Today I want to speak to you not only as a psychologist, not only as a BCBA, and not only as a clinical director. I want to speak to you as someone who has witnessed the pain of countless families, but also their hope. When a child receives a diagnosis of autism, ADHD, or another neurodevelopmental condition, families often enter a state of emotional shock. But something very important happens at that moment. Most parents do not truly understand what is happening. They do not fully understand emotional regulation, sensory overload, anxiety, emotional exhaustion, psychological isolation, or how these factors shape behavior. As a result, treatment frequently becomes focused only on reducing behaviors, controlling crises, managing symptoms, and producing visible outcomes. And yes, that can absolutely help. Of course it can. But the real question is that enough to build a functional, emotionally healthy, socially integrated life? That is the question almost nobody asks. One of the biggest modern mistakes is believing that every behavior is simply an isolated behavioral event. Very often, aggression is anxiety, isolation is depression, avoidance is fear, irritability is emotional overload, and social withdrawal is psychological suffering. And if we fail to understand that, then we may attempt to modify behavior without understanding the pain underneath it. I am not saying that applied behavior analysis is bad, quite the opposite. When properly implemented, it can be extremely helpful. But the problem is not always the model itself. Many times the problem is how the treatment is implemented in real-world environments. I'm going to say something difficult. Most families do not receive enough emotional or psychological preparation to truly face neurodivergence. And that is not necessarily the parents' fault. Many parents work long hours, are emotionally exhausted, struggle financially, or simply feel confused and overwhelmed. As a result, therapy can slowly become supervision, companionship, childcare, or entertainment, without necessarily building deep long-term adaptation. And that creates something very painful. Children who may appear to improve on paper, but later enter adolescence struggling with severe anxiety, poor emotional regulation, social difficulties, dependency, and major adaptive challenges. And honestly, that is a conversation we need to have. I deeply believe that the future of autism treatment must become more human, more integrated, more emotional, more family-centered, more psychologically informed. Not only data, graphs, compliance, reinforcement systems, or symptom reduction. Because we are talking about human beings, not machines. We need to educate parents, emotionally support families, identify anxiety and depression, understand emotional regulation, and help children build real lives, even with limitations, even with differences, even with support needs, but lives with dignity. Many of these ideas have been developed more deeply in my books and manuscripts. For years I have worked on integrating psychology, neurodevelopment, emotional regulation, behavioral science, neuroscience, and real-world clinical experience. Some of these works include ABA Made Clear, Beyond Behavior Reduction, and the Pendular Regulation Model, where I explore emotional regulation as a dynamic oscillatory process between activation, calm, and dysregulation. My goal has never been simply to write books. My goal has always been to help families, clinicians, and professionals understand the human suffering that often exists beneath behavior. If you would like to explore these ideas more deeply, my books are available on Amazon and will soon be available on additional platforms. Autism is not simply a list of behaviors. Behind every neurodivergent child there is emotion, fear, sensitivity, frustration, intelligence, potential, and a family trying to survive. And I sincerely believe that the most important science is not only the science that measures behavior, but the science that helps human beings live with dignity. Thank you for being here. If this video touched you, share it, and let's continue this conversation together. See you next time.